in our restaurant community, we see that we're continuing to see a small number of cases that are occurring. This industry particularly has been enforcing the mitigation measures that we've asked them to do with wearing masks and doing distancing within their establishments. So it's exemplary for our business community. Next slide, please. And if you look at how we're doing overall as a county, a major metropolitan county, you'll see that we're still trending lower than others. Hayes has 10,000 plus per 100,000, which is the top line, and then the middle line, which is Williamson County, has 9,300 plus per 100,000, the green line, and we are represented by the yellow line with 7,400 plus per 100,000 cases. And if you look at the next slide, looking at our deaths per 100,000, we're still trending lower than others in our surrounding county areas. Next slide, please. The admissions by race overall show disproportionate rate of admissions of Hispanics and Blacks. Next slide, please. And when we look at our zip code data, we see that there are higher numbers of admissions coming from the 78744 and 78660 zip codes. Next slide, please. The total admissions for the last period of August 2nd to August 15th were 882. 53% of those came from Travis County residents, 24% from Williamson County residents, 7.5% from Bastrop, and then another 5.4% from Hayes County residents that were hospitalized in our hospitals locally. And if you look at the next slide, please, just to take a look at what's happening as far as vaccination rates in our surrounding counties briefly. We see that in Williamson County, we have approximately 15% of the population there that's vulnerable, which means that they have not received vaccination, with partially vaccinated individuals at 9%. And then we have, of note is that 25% of the population is under the age of 18. Next slide, please. Bastrop County similarly has approximately 20%, 19% of their population that's vulnerable, and 25.4% of their population is under the age of 18. Next slide, please. Hayes County has 10% of their population vulnerable, unvaccinated, unprotected, and 23% of their population is unvaccinated. If you go to the next slide, please. Our hospital vaccination rates, as far as those who are hospitalized in our hospital, almost all of the people admitted to hospital are unvaccinated. And it's running about 85% of those who are admitted to the hospital are not protected by the COVID vaccines that are available. As we all know, there have been boosters to the Mrna vaccines that have just been approved. And however, we do know that the vaccines themselves have proven to protect against severe COVID illness, hospitalization, ICU admissions, and death. So they continue to be protective against the COVID-19 severe illness. Next slide, please. If we look at our hospitalizations by age group, you'll see that there's continuing increases in all age groups of admissions to hospital during this surge from the Delta variant. And if you look at the next slide, you will see that the ages that are most represented for hospitalizations of late have been the orange line 50 to 69, 30 to 49, and then some representation of the over 70 age group. Next slide, please. We're seeing children admitted to our ICUs, and we have a small number of staffed ICU beds at any given time. Next slide, please. When we look at the patients under age 18 admitted to ICU during this reporting period of July 1st to August 15th, there were 21 admitted to ICU, and those under 18 admitted overall 74. And there's one patient that's been reported on ventilator. That patient's been reported as a child that has some pre-existing conditions that pretend this child to be more susceptible to severe illness from COVID-19. Next slide, please. This again looks at the cases of COVID-19 that have been reported since the beginning of this year. And we see that earlier in the year we had increases in our pediatric admissions, cases, and this was during a time when masks were still in place. If we look at the numbers now, we're seeing a large number of pediatric cases again occurring when masks are not mandated and when children are not yet in school. So that is why I'm saying that we're watchful to see what's going to happen with schools opening, and we're hopeful that masks will be used to help mitigate, as we see that the numbers have increased as the mask mandate was lifted, and we had the children that have been affected by COVID during the summer are those that have been engaged in activities such as strength and conditioning training and some of the camps that occurred over the summer. We're also cautious about what's going to occur with children who are not able to receive vaccinations who are under the age of 12. So the fact that we're having this increase in pediatric cases now during a period where masks, which have been our mainstay of mitigating the spread of COVID-19 prior to vaccinations even, we're really concerned that we need to bring back mask use for our kids, particularly to protect those who are not able to receive vaccinations. And if you look at the next slide, for the total numbers of cases of COVID-19 in our pediatric population, you'll see that the numbers between the first part of this year and now have been increased by about 30% in the last 2 months because of the number of cases that have occurred in pediatric cases since the beginning of the year. To curb the spread, we must encourage our children and staff at our schools to wear a mask. Next slide, please. We're looking here at some of the questions about what's required post-discharge for some of our patients. And the majority of patients are being discharged to home. However, there are some that require skilled nursing. That is, they're requiring high-flow oxygen, they're requiring some physical therapy, occupational therapy. And for the most part, our current skilled nursing facilities are able to accommodate these patients. However, with the number of patients that we have right now in ICU, we're anticipating that we may have a need for an alternate care site. and we have plans ready to go for that. And we've made requests for staffing for such a facility to be able to accommodate that need. The next slide looks at breakthrough cases, and these are the cases of patients that have been fully vaccinated. They're 14 days past that last vaccination, so they're considered to have full protection. And we see here that we have had a number of breakthrough cases during this period of the surge. And we also note that for the most part, the illness that has occurred has been mild and has not required hospitalization. 41 patients have been hospitalized for COVID-related illness, and these are people that are not residents of our long-term care facilities. Most of the long-term care facility patients have been able to be taken care of at the nursing homes where they reside. There's been one death of a nursing home patient, and then the other 12 deaths were not long-term care facility patients. And if you look at the long-term care facility data, we've had 46 cases in the last 14 days, 135 in the last 28 days. And this is a breakdown of what the cases, where those cases have happened. 1,612 of the cases were in staff, and they were distributed largely in the younger age groups, 20 to 69, but majority of those have been in the 20 to 49-year-old, 59-year-old age range. There have been some breakthrough cases, but many of these have been mild cases as per reports from the long-term care facilities. And looking at the cases in the residents of nursing homes, as you would expect, those have been individuals who are older. And as I said earlier, many of them have been mild cases or asymptomatic. And there's been one death in one of the long-term care facility residents who was actually on hospice as well. And the question has come as to what measures are being taken to mitigate spread of COVID and manage COVID in the long-term care facilities. And this is a graphic that shows what the guidance is, and it highlights that we have been closely monitoring through our long-term care task force at APH, and have had Drs. Fry and Dr. Jason Martin, who are both hospitalists and geriatricians who work in our local facilities, monitoring as well as our APH epidemiology staff. We're following CDC protocols, and staff and residents are tested according to CDC protocols, depending on what our positivity rate is as published by CMS, and measures are taken when there's a case that's identified in the nursing home signifying an outbreak, and residents and staff are all tested and then monitored for the initial 14 days and until the outbreak is resolved. And then if you look at our progress to herd immunity, we've had vaccination uptake increases in the last several weeks. We've had 10,000 plus more vaccinations in the last week, to have 10,000 plus more people fully vaccinated in this last week. And our vulnerable population, or those who have not had a vaccination, has dropped from 15% last week to 13% this week. It is important, however, to note that we still have a population of people who are those that have had COVID-19 or we suspect and have estimated have had COVID-19 and not been diagnosed. And those people have developed antibodies which we feel will be protective for a 90-day period. However, it is still important for them to be vaccinated to get the full protection that's afforded by receipt of a vaccine series. The next slide. Our hospital regional data as of yesterday, actually these are figures from Sunday. The reporting did not come out until the week, I'm on the different slide, sorry. These are reinfection rates, for the previous period of July through August. And you'll see here the breakdown of numbers of reinfections that have occurred. And there was a significant spike, particularly in females in July. And we're in the beginning of August and seeing a similar increase in those numbers. Next slide, please. These figures for our hospital regional data are looking at what's happening in our different metropolitan areas. We see that we've crossed the threshold of 15% in each of the metropolitan areas except El Paso, where they've already had a large impact on their system from a surge previously in prior times in the year, so they're still sitting at 4.4%. However, each of these areas that has crossed that 15% threshold have limited numbers of beds, and as such, there is a limit, and there's actually not a lot of transfer that's occurring between the major metropolitan areas at this point. We've been able to manage through careful coordination that's been done by Dr. Escott and the hospitals and our EMS transport teams, and we've been able to care for patients. However, it's still important that our community do what it takes to keep the numbers of cases down by wearing masks, social distancing, hand washing, staying home when sick, and attending to only essential functions. And if you do have to go out, wear a mask, especially those who are unprotected by vaccination. We are trying as a group to continue to keep our economy open. We want to open our schools in a safe fashion. And with that in mind, we have recommended the use of masks in schools to protect our staff and our children, and particularly our children who are under the age of 12 who are unable to be vaccinated. So with that in mind, we're hopeful that we can get to the other side of this surge. And next slide, please. So what's new? We've opened a regional infusion center for monoclonal antibody therapy. It opened yesterday. Monoclonal antibodies are used to treat those who are at risk for severe illness, hospitalization, and death. And it's also been approved for post-exposure prophylaxis for those who are at risk for severe disease, hospitalization, and death. So if someone is in a home where they have been exposed to COVID from a younger sibling or someone in their house that's COVID positive and they are immune compromised, they are now eligible for this treatment that's available in our county. It requires a referral from a provider, and we have gotten the information out to our local providers and hospital systems to get those patients that are eligible for the treatment in for treatment. We're hopeful that this will decrease the need for hospitalization for these individuals. And we are working diligently to make sure that that actually does occur. The FDA has approved booster shots for the mRNA vaccines, Moderna and Pfizer, and these will be distributed by local providers in our community. People can go to their provider to talk about whether or not they should have the booster, and they can also self-attest and present for booster shots. The Janssen J&J vaccination is not included in this directive. Those who have received a single shot of J&J are not currently being advised to have a booster shot. Next slide, please. Next slide. With that, I end my report.
Judge.
Yeah, Commissioner Trevelyan.
Just a quick question. You laid out the number of ICU beds and ventilators. We got information on that. Do we have the same type of information on the capacity of skilled nursing facilities? I know we talked about them, but I didn't see numbers that said, this is our capacity and this is the level at which they're being used at this point.
We do not have eyes on that information directly. They are private companies, and they don't all have the capability for housing COVID patients because of their current census. We have identified approximately 37 beds that can be used at this point in time for skilled nursing, and the capacity fluctuates depending on admissions and discharges, just as our census in hospitals does. So I can get that for you, Commissioner, and let you know.
Thank you. Yeah. Thank you. I think that would be important to know over time. Okay. And then just very quickly, we noticed that when there are vaccination spaces that allow physicals as well, you often get 2 or 3 times as many students coming for physicals and then might take their vaccinations. Can we add in our strategy as we go forward, particularly as we talk about the back to school programs that we're participating in, that we have the capacity to add school physicals as well as vaccines as another means of attracting students that might want to get the vaccination also?
Yes, sir.
Thank you.
Director Stirrup.
Thank you. Good morning. And now I will give an update on the operational side. And as always, just a reminder and an opportunity to remind our community of where we are in terms of staging and what the behaviors are that we are asking folks to undertake so that we can stay safe. So that's masking, washing your hands, staying home if you're sick, getting tested if you feel sick, and most importantly, being vaccinated. Vaccination is the long-term game, but right now, to get out of this surge, masking and social distancing will be important. It's all about testing these days, so I am glad and happy that the community is responding. Over the last week, we did over 3,000 tests. You can see here on this slide the locations where a resident can come and get testing. We're at the Dove Springs Rec, at St. John's. We offer in-home testing. All you have to do is call 311, and we continue to support our facilities with testing at senior centers, homeless shelters, and the like. in accordance to the data shared to us by DSHS and evidenced on the slide that Dr. Walks shared earlier about the number of deaths in Pflugerville, we are continuing to look at ways to partner with that community and add additional support. As such, we've added a new testing site. It's located at 103 North Railroad Ave in Pflugerville. We expect to launch in September, so it's not open yet, but we expect to launch in September. As with all of our sites, it will be free and there are walk-up options available. We will stress that your appointment will go a lot more quickly if you do pre-register and make an appointment, but that should not be a stumbling block. You can schedule online at the web address cited here by calling 311 or by calling 512-974-2000. And recognizing that some of the text and the graphs might be hard for the public to see, I also want to remind folks that these slides will be available on our website for you to download and read at your leisure. When looking at our vaccine dashboard update, and this number here just represents shots given by Austin Public Health and Community Care. In the last week, we gave 1,322. And if we look at the next slide, this shows the vaccine data for Travis County by race and ethnicity. And last week, there was a question about the total number of shots given in our county. And so we can look at this bottom number here circled in red and see that at a minimum, we've given over 800 shots. And then when you count the number of folks who are fully vaccinated, that gets our number up to 1,483,241 shots in Travis County. We will continue to work with our partners at the county and with the collaborative to get those specific numbers by provider, but this gives you the total outlook for the county. So when we look at our first dose map, unfortunately, not too much change over last week. And again, just to remind the community, the blue means that that zip code is over 60%, and the green represents areas that are 70% or higher with first dose penetration. We only have one small circle of yellow to tackle in 05, and we are deploying our mobile vaccine program in any space available in that community so we can help drive those numbers. When we look at our second, this is a new map for the group, and so this shows our second dose fully vaccinated population. So unfortunately, there's not as much green on this map as we would like, but we are, and it's not surprising that we're showing the same areas that kind of lag behind for first dose are below that 50% mark for being fully vaccinated, Of note, of course, is 17, and we will continue our efforts in Southeast County to make sure that we are working with our partners to get as many folks there fully vaccinated as possible. Other zip codes of note are 42, 05, and 53. When we look at our vaccine operations for the week, a reminder that we will be at all of our static locations. And so that's Southeast Library, Little Walnut Creek Library, the Anna Lark Center. In partnership with Travis County, we will be at the Del Valley Opportunity Center and at the Turner Roberts Rec Center. For more detailed information about these locations and the type of vaccine that you can receive, please visit us at www.austintexas.gov. For this week, our mobile operations will be at approximately 25 different locations, including 4 ACC campuses, 9 middle and high schools, the Montopolis Flea Market, and the South Austin Market. I do want to point out to the community that we are planning the incentive program full rollout. Last week, we had a limited number of gift cards for a trial basis. We are putting together the incentive that will give folks being vaccinated within this time period to receive up to a $50 gift card for each shot. We will have information available on our website once the program is launched about where and how you can get that gift card. And again, focusing back to data-driven decisions for operations, really stepping up the outreach in the Pflugerville area, partnering with our ISD out there to be in middle schools, to plan events in consultation with administrators and the public to make sure we're offering as many opportunities as we can for families to get vaccinated, to ask questions about vaccine, to receive information about vaccine. And so we're really trying to have a larger footprint in that area to drive those numbers to a better place. And so in her comments earlier, Dr. Walks talked about the vaccine booster that was recently approved by the FDA and CDC. And so the recommendations are for those who are immunocompromised. And we're really directing our public to talk with their healthcare provider to determine if an additional dose is appropriate for them. If you do not have a regular provider or cannot find a site to get vaccines, APH expects to, within the next few weeks, to set up a program to offer boosters to the community. Once that program is finalized, again, we will share information through our regular media outlets in this venue, and we'll have that information posted on our website as well. And again, I know there's a lot of text on this slide, but it will be available for the public to download from our website. Some of the criteria for folks that might need a booster are if you're receiving treatment for tumors or blood cancers, if you're taking immunosuppressing medications after an organ transplant, if you're within 2 years of receiving CRT therapy or a stem cell transplant, if you have primary immunodeficiencies, rare genetic disorders that prevent your immune system from working properly, if you have advanced or untreated HIV, and if you're taking high-dose corticosteroids and other agents to help if you have immunocompromised systems, and other chronic medical conditions such as chronic renal disease, or if you're receiving dialysis. And so that's just a snapshot of the list. It's exhaustive on the CDC website as well as our website to help you figure out if a booster is right for you. And as always, we are trying to expand our media presence to make sure that we are giving the public the most recent and up-to-date information as possible. We responded to over 60 inquiries last week. Key points of discussion have been patients in the ICU are sicker and staying longer. ICU staff are seeing younger people in our hospitals. And the other point is that the Delta variant passes from person to person with much more ease. So the vigilance with hygiene, masking, and watching distance is of paramount importance. And of course, our back to school messaging. Focusing on getting our kids that are eligible for vaccine vaccinated, supporting our kids in wearing masks and making sure they stay at home when they're sick. In the ride to school today, my son commented to me that, nobody in school is wearing a mask, and it made him feel a little awkward. And I had to talk him through the reasons why masking is important. And like a champ, he could rattle them off. And, I said to him, you can be a leader, not a follower. You know the information, share it with your friends. And he whipped his mask out before we got out of the car, purple to match his purple hair, and put it on and winked at me when he got out of the car. And so I know it's a stressful time for our families and kids, and we all need constant reminders and encouragement and support to do the right thing. And so with that, I thank you for your time this morning.
Thanks, Director Stirrup. Chuck, are you available? or Constable Morales?
Judge, Mayor, yes. Chuck Brotherton, Travis County Executive for Emergency Services. Today, of course, we've got Constable George Morales with Precinct 4 and Fire Chief Ken Bailey with ESD 11. I'll turn things over to Chief Bailey.
Good morning, Judge, Mayor, Council, and Commissioners Court. Ken Bailey with Travis County Fire Rescue. I'm going to share my screen. Reporting for the County Collaborative. We, to date, have now done about 27,000 doses, with about 24,000 of those being Travis County residents. We have now planned or executed on 322 different mobile events, which does not include the expo. And all of these numbers do not also include CODA, which was a major effort somewhere in the neighborhood of about 80,000 shots prior to April. We have seen an uptick of about 231% of first doses compared to the first 16 days of July. And Constable Morales is going to talk to you about our outreach efforts.
Good morning, Commissioners, Judge, Mayor, Council members. Again, we continue to focus our outreach and education, making sure that our mobile vaccines are successful. We have increased our outreach this last week by doing a total of 6,305 phone calls. Our teams have distributed 21,381 flyers. Our mobile teams gave a combined shot of 1,849 shots this past week, with a combined shot total for August at 3,554. We will be working on shot locations in the Wells Branch area and the Pflugerville area communities. We will be working with, again, our partners with AISD and DVISD to continue the vaccine, to continue to vaccinate our students. What is unique about the mobile vaccine is our versatility. We can move and pivot into areas of high need as quickly as possible. So when we get these phone calls and they said, hey, we think we have a good shot here, we want to make it happen, can it happen this week? We usually jump all over that as quick as we can. And we want to make sure those numbers are great. One thing that we do, our upcoming schedule this week, is working with Rodriguez Elementary, their second dose clinic, and we had a really good turnout with the families there. We have a Travis County Community Center in Foothill Farms. We will start that this Friday and giving shots into that community. Wells Branch Community Center, River City Youth Foundation, the Mexican Consulate, Houston Children's University, and of course, all 4 JD supermarkets, to include the Travis County Criminal Justice Center we're going to be doing this Friday. As I try to do every week, and give shout outs to a lot of the team members that we have out there that do an amazing job for us. One is thank you to Council members Allison Alter and Director Kim Neely from Parks and Recs for helping us get some transportation. And especially our outreach team, Alex Curtis, Ruth Garcia, Daniel Alvarez, Kevin Ramirez, Kayla Ramirez, Ty Henderson, and our 2 project coordinators, Jack Chikinchan and John Lawler. As we continue to push forward, our success is measured on participation of every one of you and the effort that you support us with. And I wholeheartedly want to thank our council members, our commissioners, our judge, and our mayor, and especially the Austin Public Health for their collaboration with us and making sure the message is continuous. Thank you.
And if I can, one last thing, we are preparing our system to start with third doses and coordinating with the state. From a technology standpoint, we hope to have that done by the end of the week, but we are coordinating with the state as to when they're going to be ready to accept those. The other thing is that I still think that there's a lot of work to be done in regards to bending behavior. This weekend, we had probably a 5,000 person event with not a mask in sight and people shoulder to shoulder at one of the rodeos that was out here in our area. And I think this is an education piece that we must be, we shouldn't ignore and continue our efforts. Thank you.
Judge, Mayor, Court, and Council, as I do every week, I just like to show our residents how easy it is to find vaccination information. As you've heard, we continue expanding our outreach efforts. The collaborative in July did nearly 5,000 doses, and we look to exceed 6,000 doses in the month of August at Expo and at the other locations. And I'm going to share my screen very quickly, if I may. At traviscountytx.gov, this is the landing page for the county's website. And it's very, very simple just to click on that link, and it takes you immediately to the calendar of vaccine events that we are scheduling each day. The calendar shows both County Collaborative, Austin Public Health, and a handful of private provider locations, as well as ESD8. Again, simply click on any one of these links. This is the JD's Market at Cedar Creek, and you see all of the information, date, time, what vaccines are available. So that's very simple. The same link is available through the austintexas.gov/COVID-19 website. You can get to this same information. And for information about private providers, vaccines.gov is a great resource for folks to go to and find out where they can get a vaccine at a nearby pharmacy, CVS, Walgreens, HEB. All of those are available on vaccines.gov. And I will stop sharing right there and pause there for questions. Thank you.
Awesome. Thank you, Chuck. So thanks, everybody, for all your work. We're going to go through the question portion. So first, we'll go to members of the Commissioners Court, then the judge, then members of City Council, then the mayor. And again, ask y'all if we could limit ourselves to one question each. And I will start with Commissioner Margaret Gomez.
Thank you, Judge. Again, this information is really concerning to me, and as we continue going out and educating the public, I think is one of the most important goals that we have. The end result is, of course, the vaccination has always been that. But I want to say to the collaborative team, I'm so proud of y'all. All the work that you have done in reaching people and communicating one-on-one and encouraging them to get vaccinated. So, I mean, your efforts are really paying off, and I'll be eternally grateful to you. So thanks very much.
Commissioner Shea.
Thanks, Judge, and thanks to all of the healthcare providers and all of the folks who are continuing to try and keep our community healthy and safe in spite of a lot of really unnecessary barriers. I was trying to understand the numbers, so this may be a question for Dr. Walks. I think you'd indicated about 85% of the people who are currently in the hospital are unvaccinated, but the numbers kind of threw me. It looked like there were 800 some in the hospital and then 400 some unvaccinated. If you could provide a little more clarity on the numbers in the hospital. I understand that the continuing bulk of the issue with people ending up in the hospital are people who have not yet been vaccinated, but I'm just trying to get a better understanding of the actual numbers.
So we don't always get the question answered by the patients, and are not always able to verify their vaccination status. So those numbers that we have are those that have been verified by our team for accuracy. And so that's why there's a discrepancy in the numbers, just as some of the numbers that you may see on slides here may be for a certain date or point in time, and they're subject to change because the census changes and hour to hour. So,
are we keeping track of people who are refusing to say whether or not they've been vaccinated? I'm going to assume that is mostly people who are unvaccinated, but are we keeping track of that number? That seems like that's a really bad trend. If people won't even say when they're coming to the hospital whether or not they've been vaccinated, are we tracking that?
We have an unknown category, yes.
Unnamed? Was that what you
unknown? unknown. Yeah,
Thank you.
you're welcome.
Commissioner Trevilian?
All right. Once again, I want to thank the team and its efforts to really reach into communities and to find trusted community members to work through. I want to thank you for your efforts in that process. I really want to ask what we can do immediately to add school physicals to the vaccine process, because that seems to get many more students interested and many more parents interested when we market that way. Is there a way that we can do so? And I am also interested in understanding what we are doing with our training apparatus, meaning local workforce boards, ACC, Capital Idea, and other places about continuing to build out our healthcare workforce, because now that we're going to boosters, who knows how long this is going to last. What are we doing to use our workforce resources to make sure that we're training enough people to help us where we have shortages?
And so I'll start, Commissioner, and then invite my colleagues to add to. From Austin Public Health's perspective, in order to add the physicals to the vaccine operations, we would have to have conversations with our local community center or health center partners, because that is not within the purview of what Austin Public Health can provide. So there's that. Secondly, I think there is opportunity, as you said, to make sure that we're building out our workforce. Austin Public Health did receive a 2-year grant from the CDC that focuses on public health workforce retention and recruitment, specifically a diverse workforce, understanding that we have a health equity issue at hand with COVID. And so our team is currently working on the plans to, one, add community health workers, add and train community health workers, and then to work with our Houston Tillotson and other institutes of higher learning to figure out how we can have a more intentional recruitment strategy to make sure that we're capturing those minds that might not even have realized that they could have a career path in public health. And so those plans are underway.
If we can meet sometime this week, I will make time this week. We have put together an advisory team with that purpose. So if you will, if our offices can connect, I will connect you with the community team put together precisely for that function.
I appreciate that. Thank you.
Thank you. Commissioner Howard?
I don't have any questions at this time. Thank you.
Thanks. Just got one, Director Stirrup, I think, for you probably, or maybe for Cattrack, who's not here, but I'm really excited that we have the infusion center set up. I went out and looked at it yesterday out at the Expo Center. Obviously, people can't go directly there to access it. They need to first get a referral from a doctor. Could you talk a little bit about how we're encouraging people to do that and sort of publicizing that it's available for people who test positive for COVID, are in a high-risk category? I just want to make sure we're getting the full utilization out of that so that we can steer people away from the hospitals.
So we have disseminated the information to the membership of 4,000 plus doctors that are part of Travis County Medical Society. And we've also sent the information out to the presidents of the county medical societies that surround Travis County. We've also sent the information to freestanding emergency rooms, and we will be doing more of the same going forward. We're also planning to put it on our website at APH, and it also appears on the CATRAC website.
And if folks don't have a doctor and they test positive, I'm just trying to think through that scenario. Maybe I'm not thinking it right. Like if they test positive for COVID, they're in that high risk category. Can they call 311, or could they if they don't know how to get to a doctor, I guess, is my question.
Yes, we're going to put messaging at the 311 call center to give instructions on how to obtain a referral from a provider. As you know, we just opened yesterday, so we've not widely publicized it because we wanted to make sure that the process was going to be going according to plan. But that will be part of the process as well.
Awesome. Thank you so much. Thank you. Mayor, I will pass it over to you.
Judge, thank you. We'll go through the council. We're starting at District 10, working our way back up. Councilmember Alter.
Good morning. Director Stirrup, I was wondering if you could speak a little bit more to the plans for rolling out the booster shots so that we can avoid a distribution challenge, especially with respect to information distribution and making sure that our systems can handle the volume. I understand that the plan at this point is fairly limited booster shots for those who are immunocompromised, but it sounds from what we're hearing that there will eventually be a third booster shot for all. And I'd like to understand how we're planning so that we can avoid some of the challenges that we experienced earlier this year.
I'm smiling because we had that conversation this morning in our executive leadership team. How do we avoid the backlog or the wait times that we saw when the vaccine first became available? And so seeing that we got the final direction, I believe just yesterday, we're going to take that information and meet with our IT teams to see how we can shore up our systems to kind of, and it's a very complex process, and I'm going to give it to you in the layman's terms how I heard it. We need to be able to help our system distinguish between a patient who's been with us for 2, a patient who's been with us for 1, and a new patient. And so while we work that out, we will have the walk-up option just so that our technology lapses won't be a barrier. But the formalization and the shoring of that planning will happen today. And so the bones are in place. We've identified the staff needs that we'll have. We've talked about locations. We've talked about how to integrate that into our existing sites. We've built out the initial questions that someone will have to answer for the self-attestation. And so those key pieces have already been in place, but now with that final guidance, we can put all of that together and have a more formalized plan, which is why I said in my comments earlier that once we have everything in place, it will be announced to the public. But yes, we have our eyes on making sure that we can make it as seamless as possible. We're also hoping that we're in a different place than January when APH was one of the few providers in our community. And we're really hoping that now that that vaccine is more readily available, that we won't kind of see those wait times at the centers that the county or the city will set up.
Thank you. That's good to know. So you're also preparing, though, to, because there's the immediate opportunity for the immunocompromised, but as that opens up, there will presumably be a surge that may go in some waves similar to what we had, because it will mimic when people are 8 months out or whatever the recommendation is at that point in time. I just want to make sure that we're also planning for that stage where it may be a much larger group of people.
Yes, ma'am. And in full transparency, one of the biggest hurdles will be a location that could handle a mass clinic. When we had the Delco open, we were in a period of where not much was happening. Schools weren't in session. And so that will be the thing that we need to kind of nail down. Where could we hold a mass clinic in the time where everything is open and people are out and about?
Okay. Councilmember Tovo.
Thank you. I have a couple of observations and a question. The first is, Commissioner, could Commissioner Trevelyan mentioned asked about the possibility of adding physicals to vaccine clinics, and I wonder if the reverse could be true. As AISD and other school districts do some of their physical clinics for families, I wonder if those are good opportunities to add the vaccine, if that's not already happening, and it may be fully in swing already, that partnership. This is really kind of inside baseball for the city of Austin, but manager, maybe you could report back to us on this. I recently learned that our health insurance has started charging office visits for COVID tests that happen at certain locations, including urgent care clinics. That wasn't always true through the pandemic, but as the pandemic waned, apparently that office visit charge started getting applied. And I really want to encourage us, since I believe it's a city of Austin choice, to rethink that so that we're really encouraging. We, of course, want to encourage testing and make sure that that's as accessible as possible to Austin employees. And so allowing them to go to a variety of places, I think makes good sense. And then my question is for our APH. I noticed that we talked briefly about 7875 last week. And as I mentioned last week, it is primarily West Campus, so it includes a few neighborhoods. I appreciate, Director Stirrup, that you mentioned you to have a mobile van in that area. And I wondered if you could just speak for a few minutes about what kind of coordination is underway. Are you working with sororities and fraternity houses and co-op housing in that area to coordinate on that mobile vaccine? Is that something that UT is assisting with? Again, it may be, as we talked about last week, that some of those students have been vaccinated elsewhere and the information isn't necessarily coming through. But to the extent that, that is our last yellow pocket in the city of Austin. Understand kind of what the plan is to coordinate with some of those on the ground organizations that can really assist in getting folks vaccinated.
So you're exactly right. It could be a lag in us understanding if the students have been vaccinated elsewhere. And I understand that the team is working closely with folks at UT for that more detailed level of coordination. And I can certainly find that out and we'll revert back to you.
Sure, and if there's any assistance you need from my office in terms of providing ideas about organizations in the area or neighborhood associations or others in that 78705 zip code, happy to assist.
Thank you.
Okay. Councilmember Ellis is not with us today. Is Councilmember Poole still with us? She was with us earlier, but I know she had to step out at about 10. It's just Councilmember Kelly.
Thank you. And thank you for that great presentation. I want to start out by saying I know someone who went and got the transfusion and it really made a world of difference for them and they're recovering. So I'm glad that we have that resource available. My question is, what is the metric or standard we need to reach in order to rescind the mask order? I was just wondering what that might look like for the future.
When we are at a point where the pandemic is under control and we have the herd immunity that we need to function in society and know that it will not spread and rebound again.
Thank you for that. Could you clarify with numbers or some type of data so that we can have an expectation?
So the WHO considers the pandemic to be under control when we are below a positivity rate of 5. We would consider the pandemic to be, or the outbreak to be over when we have had 0 cases within 2 incubation periods or 28 days.
Thank you very much.
Thank you.
Councilmember Kitchen is not with us today. Councilmember Kassar.
Thank you, Mayor. First, just a point of information, since I know the commissioners are discussing this later today and it was raised during testimony, but we had a presentation at the city's housing committee recently about how we've reached about 10,000 people with the city's rental assistance program and 5,000 households, overwhelmingly households led by women, overwhelmingly in the zip codes that have been hardest hit by the virus. So thanks again to Ms. Jackman for leading that program that's gone to about 10,000 people, and we're here to help in whatever way to model that program for the county or anywhere else that is still getting its dollars out as we still try to get our dollars out. My quick question for Dr. Walks is the slide that you showed was really upsetting to see that we had one ICU bed, staffed bed available. We know that it's low everywhere across the state, but we had that lowest number. Can you talk us through what it means to have just one ICU bed available? I mean, I saw in an earlier slide that you talked about a real handful of children that had needed an ICU bed. If we have a couple of car accidents, if there's a couple of children that unfortunately need an ICU bed in our community, if suddenly there's a need from 5, 6, 10 people today or tomorrow that need an ICU bed, what happens? What does that mean for us?
Well, that number was from Saturday because there's a delay in the reporting. And so let me preface by saying that. And if we come to a point where we need to have a person hospitalized in an ICU setting, there will be arrangements made to take care of that patient in a non-traditional ICU setting until a bed becomes available. But you're right, that would be a stretch. We would have to activate what we call surge plans. And so it's not ideal, but we will take care of that person. It's just going to delay care for somebody else who's not in a situation of needing that critical care.
And I appreciate you mentioning that I'm right, but I'm not sure exactly what I was right about because
You're right in pointing out that is a serious issue that we need to address as a community, and we are addressing in the medical community by making adjustments in the flow of things. So we have patients during high points of high traffic times where we have patients that are on stretchers in hallways instead of in rooms because we don't have enough rooms. We use non-traditional spaces to take care of patients who need ventilators or life support, for instance. Instead of using a cath lab that we'd use to do a cardiac cath on somebody for that purpose, we convert that to a space where we can provide emergency care and put somebody on a ventilator. So we make adjustments when we need to in our hospital settings, but that's not ideal. And you're right to point out that we only have a finite number of staffed ICU beds that we have listed, and that when we exceed that capacity, we have to make adjustments.
So there would be a deteriorating level of care for either the people in those car accidents or with those heart attacks, or for people in less critical situations that are in the hospital. We would do our best to take care of everybody, but there might be deterioration of the level of care for those people.
I wouldn't use the word deteriorating. I would say that there may be people that are waiting longer for care, for non-emergent care, but we will triage and prioritize those who need higher levels of care and do our best to provide the care that we need to give people who need emergent care or higher levels of care.
Got it. And so you would potentially staff or resources would move from less emergent cases to more emergent cases to try to increase non-traditional ICU type capacity.
Yes, sir.
Thank you.
Thank you.
Councilmember Mrna.
Yeah, thank you, Mayor. And I want to also thank all the people that have been out there working really hard on this. I just want a description on in-home testing, how it works, and how you administer that program.
So a client can call 311 and be directed to our team to schedule an in-home test. And a nurse and a patient rep shows up with a little cooler bag full of vaccine, and the person can get their shot in the comfort of their own home. It's really as simple as that.
Thank you. I just, it was kind of, when you said testing, but I thought maybe that y'all just went out there and picked up a kit and did self-testing, but this is basically in-home testing. Is just you're actually getting a vaccine shot.
Oh, and you know what? I'm so sorry. I realized you said test, and I'm so vaccine focused. But yes, it's the same thing. A team will show up with the swabs and administer the test for you at home in the same way if you showed up to the drive-through location. So it's still the same process. It might be one person instead of two, since the vaccine has a lot of data entry that's required. But yes, it's the same process. You could call 311 and we will come out and give you a test at home.
And this is basically when you're feeling sick, you already been vaccinated, or just if you just haven't been vaccinated and you're feeling sick, they'll come out there and do that for you.
It's for anyone who is feeling ill and has some exposure to COVID, we can come out. It doesn't matter if you're vaccinated or not. It's really for those who have either limited mobility or don't have transportation or any other way to access one of the drive-through testing sites. We don't want that to be a barrier for people to know their COVID status.
Well, thank you for that information.
You're welcome, sir. And while I'm on the mic, if I could just, Councilmember Tovo, I did get the answer from the vaccine team. We are working with UT Health. They're the lead on that effort, and we are providing support. And you are quite right. They've hosted several clinics with the different fraternities and sororities on campus. And so we will continue that partnership and help them in any way that we can.
Wonderful. Thank you so much for that follow-up information, Director.
You're welcome.
Councilmember Fuentes.
Thank you. My question is for Dr. Walks. I wanted to get some information on our progress toward reaching herd immunity, knowing that our community is about 56% fully vaxxed and 65% with the first dose. And our initial target was to have 70% of our population fully vaxxed for us to reach that herd immunity. Has there been any changes towards that benchmark given the rise and surge of the Delta variant and possibility of other variants happening? How should we be looking at our efforts? Is there a new benchmark that we should be mindful of, or are there any changes towards that progress toward reaching herd immunity?
So we're still working towards getting as many individuals as possible vaccinated in our community. And the actual benchmark has probably shifted toward 80 to 85% fully vaccinated for herd immunity number that would give us protection in the current situation that we find ourselves in with the Delta variant, because of the increased level of transmission and spread of that particular variant. But the real goal is for us to get as many people as possible vaccinated rather than a particular target, so that we can protect as many people as we possibly can in our community. Did that answer your question, ma'am?
It's helpful, and I'm with you that and I love to see the progress that we're having in vaccinating more of our community. And I think with the recent investment in community health workers that council supported, we'll have even more boots on the grounds to help in that effort. The other question I had real quick is around our testing strategy, knowing that the static testing sites that we have are PCR tests. And what I hear from the community is that, it takes a couple days before they find out whether or not they have COVID. Is there any consideration to having rapid tests available so that individuals find out a little bit sooner if they are infected? And I think that might help us curb the spread of COVID, especially with the Delta variant. But if y'all have considered it, what is the rationale about not having rapid tests available for the community?
We have considered rapid testing, and that is what is being used in the school systems to identify people that have symptoms and also asymptomatic individuals in congregate settings, such as long-term care facilities. We're also using rapid testing in that venue as well. So rapid testing is being used. The use of the PCR test is what has historically been used by APH. And at this point, we're taking the use of rapid testing under advisement and looking at processes and ways to incorporate that into the armamentarium so we can, as you say, have a better sense of the level of infections in our community and the burden of infections in our community.
Thank you for that, Dr. Walks. And just to add really quickly, in full transparency, again, there are some operational challenges with using the rapid tests, albeit the resident will get their result in 15 minutes or less. We would still have to confirm with the PCR test. And then there's some lag in the data reporting, and because it would have to be done manually. And so that becomes very resource intensive. And so when we're looking at those rapid tests, we have to look at where they would be most useful and not be a drain on the overall system. And that's why Dr. Walks pointed out in the schools or in other places where that's an environment that's more suitable. But for us to really shift our major testing sites to that method would take some more planning and some additional resources that we don't currently have at hand. But as she said, it is something that we are working through. I just wanted you to be aware of all the parameters.
Thank you. No, that's super helpful. And certainly, I think, just considering having that as an option, I just know from folks who are worried that they've been exposed or they have COVID and they're feeling ill, that lag period before finding out whether or not they are infected is crucial, because they might still go out and see other people and then the spread is just continuing. So it might be something to consider, but I certainly understand the capacity limitations that we have associated with it. Thank you.
And it's helpful to note that if someone is feeling ill and they suspect that they have COVID because of exposures and that sort of thing, that they are being advised to isolate until they do have those results, so that they do not spread.
Mayor Pro Tem.
Mayor, I appreciate it. I appreciate all the hard work that's gone into being able to present us with this information and keeping, real accurate, real-time track of the data. I appreciate all the questions that preceded me, in which case I'm going to ask one that I've been asked, and I found myself wondering myself. I really wish I could show you my phone, but I was driving down 6th Street on Friday afternoon, headed to the bank, and for 2 city blocks, it was chock full of people standing within a few inches of one another. And I mean, my video would show you, I took video all along the way, not a mask in the bunch. And so I just wonder, and my constituents have asked me, when we find ourselves in a situation where you see something like that, hundreds of unmasked people congregated in a way that's clearly not safe. Lord knows where they were headed. They were all in a line to go inside a building. What does one do in that situation?
That's a difficult question to answer. I think that right now we're leaving it to personal choice for adults to make a decision on face coverings, and those individuals are making a choice that impacts the entire community. So that is a difficult question to answer. We don't have any recourse at this point for that situation.
But we do have some rules around congregating, though, don't we? Am I mistaken about that? No rules?
We have recommendations, but our recommendations don't have any means of enforcement. So we can only recommend.
That's unfortunate.
Right. Yeah. Yeah. Under the current orders, there isn't much that we can do around enforcement of occupancy limits and the like. It's simply recommendations.
That is indeed unfortunate. I hope maybe as a community we can get together and, really put our weight behind our decision making as far as our spending is concerned. I certainly would prefer to reserve my limited dollars for companies and businesses that adhere to the greatest overall good for our community. So that's what I'll be doing with my dollars. Thank you for the responses. I appreciate it.
Thank you.
Just following up on something the Mayor Pro Tem has raised, first of all, orders. I want to thank Dr. Walks for moving forward with her order to mandate masking in schools and in city facilities. Thank the judge for doing the same. We have all three orders out that do that at this point, and the district court here in Travis County is making those orders controlling. To your question, Mayor Pro Tem, we could increase the orders to also include a citywide mandate for masking and the like. And the decision and the direction at this point has been, not to do that at this point, but to really just step behind and support the parents and the school districts that are forcing that issue. And we'll watch what happens to those cases as they move back up to the Supreme Court. But keeping the kids in the schools really center now, because unvaccinated, they present a unique risk. Dr. Walks, in the PowerPoint presentation that you presented on page 4, you had some numbers about restaurants. Is there a conclusion to be drawn about restaurants from the data that you presented?
I was showing that to say that they are using the mitigation strategies of masking, social distancing, hand washing, et cetera, and have been able to keep those numbers in check within their establishments as per our reports to APH.
And is that looking at restaurant employees, or is that looking also at restaurant customers?
Those numbers, to my knowledge, are for restaurant staff, not for customers.
Okay, the ones in the restaurant that are masked. It's good that we have a lot of restaurants doing that, and I think really support the restaurants that are encouraging masking and encouraging vaccinations, and really appreciate the restaurants that are trying to figure out a way to be able to do that and get around the threats of the loss of liquor licenses, because that's really behavior and for an employer to be able to do in their own shop is something that seems something we want to be able to encourage, and let businesses at the very least be able to make those decisions for themselves. On the ICU bed question that Councilmember Kassar raised, the strain on hospital seems to be higher in Houston and Dallas, in terms of number of cases generally, but we seem to get hit with the ICU shortage more quickly than some of those other big cities. I don't know what the long-term solution is to increase ICU capacity in our city for events like this, but it seems as if we get to that choke point sooner than some of the other major cities in Texas, Houston, San Antonio, and Dallas. So I just note that it's not a short-term thing to look at, but something probably longer term.
Mm-hmm.
You said that no booster shot right now for the J&J, the mRNA, was looking like there would be a booster here initially for compromised or vulnerable people. Why is there no booster shot being talked about for J&J? Is that it hasn't been shown to be effective, or there's just not the clinical data to support that action now? Do you know?
They're still looking at the data for J&J at this point, and have not reached a conclusion as to whether a booster is required or not.
And then I would just add my voice to my colleagues earlier with respect to the APH system on the booster shots. That's probably one of the most outward-facing things that we do in terms of the community looking at how effective we are. Certainly there are lots of standards, but any other support that's needed in order to make sure that when we roll that out on the website, we've stress tested and made sure that we're going to be able to deal with that in a way that doesn't have people just sitting on the phone or having the kind of issues that we had a year ago. Please make sure that you have the resources to do that. That's all I have, Judge. So I'll turn it back over to you.
Thanks, Mayor and council members, and thanks in particular to all the folks working hard to control the spread of the Delta variant of COVID, and congratulations to the AISD students going back to school today, and others. So that is it. That's all we have. I guess we're going to adjourn until 10:45, and we'll come back as a commissioner's court at 10:45. And Mayor, I will pass it over to you to do the same.
Okay. With that, we'll go ahead and adjourn the city's portion of the joint meeting here on August 17th, 2021. It's 10:35. Judge and court, again, thanks for letting us join you.
Thank you.
that you asked him for.